Do you still need to sign up for healthcare coverage for 2014? You're not closed out yet. Greg Young's here to bring us up to date on the deadlines and developments with the Affordable Care Act, known as Obamacare. Greg's the Director of Strategic Policy and Initiatives at Medical Mutual of Ohio. Greg, thanks for coming back and helping us out here.
Thank you.
So last time we talked about healthcare exchanges. We were getting ready for open enrollment.
Right.
The period of time when people should begin to select new coverage for 2014. Where are we now?
Okay, there's been some confusion as there's been a little bit of kind of a bumpy ride as we've rolled out the ACA in 2014, the exchanges. But the exchanges are there. And just to refresh people, they're an online marketplace for the sale of health care plans where people who are qualified can compare plans side by side and get that apple-to-apple comparison. But here we are in January,
right.
And we're in the middle of that open enrollment period that ends March 31st. So people have to get that coverage by the end of March or they're going to be shut out for 2014. And there is a penalty if they don't have health care in 2014.
All right. Now, when you were last on the show, we talked about the costs. Subsidies, though. I want people to know, are there still subsidies out there available, and who can get those?
There are, and the subsidies are, I think, very, very important. When you look at the subsidies, they go up to 400% of federal poverty level. And so if you're looking at an individual, that's an income of $46,000. Then you have a household of 4 people, up to $92,000. So those are, that's a pretty significant range where they're going to get those subsidies.
Absolutely. Now, that's huge.
It's huge. But remember, the more you make, the less you get in terms of the subsidy.
But the subsidies are really meaningful. These are not, a buck here and $2 there. These are really helpful.
They're very meaningful. And as we said, a lot of times people are looking at more expensive coverage because they're getting more in terms of the benefits. So the subsidies will be very helpful.
And as you mentioned earlier, everything hasn't gone real smoothly, but getting a little better now.
Right. There, as we said, there were some bumps and bruises as it all kind of rolled out. But what we've seen is things are calming down.
Yep.
There have been, some temporary fixes put where we've identified problems, and then where those problems exist, they're working on permanent fixes. So, it is getting better.
And is it possible for people still to buy health insurance?
And I think that's the bottom line. That's the big question, and certainly it is. People should, if they go to healthcare.gov, which is that federal website,
right.
And if they have problems, they have the option of going to, their health insurance company, if that's where they've purchased coverage, going to their agent or broker, if that's where they've purchased coverage, so they can get coverage.
And small businesses quickly?
Yeah, with the small businesses, there was to be a separate exchange called the Shop Exchange in 2014. Again, bumps, so that's delayed till 2015.
All right, so
but
things are going better, the subsidies help the costs, and people should take a look.
Absolutely.
Thanks.
Thank
Great
you.
information.
Thank you.
You can buy health insurance, you can, and for those who have had to do without it for a variety of reasons, this is great news. So what are you waiting for? And if you need help, contact Medical Mutual. They want to help. My thanks to Greg Young for joining us today.
Find out more about Medical Mutual of Ohio by visiting their website, www.medmutual.com.